Hello, madam.
Good morning, sir.
Good morning, ma'am. Soumya here.
Sir, how are you, sir?
I am fine, doing well, and now I am really delightful for this opportunity.
Thank
Thank
you,
you very
sir, for
much.
accepting our invitation. Sir, we
Great.
will start. We will start the seminar from 11 o'clock, sir.
Yes, yes, I am okay with that. Excuse me, ma'am. If you can give me the sharing authority so that I can share my PPT, or if you can run from there, I'm okay with that also.
Yes, sir. Sir, you only share your PPT, sir. I will allow you, sir.
Okay.
I am making you as co-host, sir.
Okay.
Yes, sir. Sir, you are now the co-host, sir. Please check if your screen is. Shared or not?
Just a minute, ma'am.
Okay, sir. Yes, sir. Yes, sir, it is visible, sir. Fine.
আমি দেখ Good morning,
Good
sir.
morning, sir.
Echo হচ্ছে না, সরিয়ে দাও। Hello. Can you hear me?
Yes,
Yes,
ma'am.
ma'am, I can hear you. It's clear.
Yes, sir. Yeah, good morning. Myself, Dr. Indrani Bhattacharya, Principal of Pandaveshwar School of Pharmacy. It's our immense pleasure to have you in this webinar, sir. So,
Thank you.
Okay. So, Deepika madam is there, our coordinator. Deepika ma'am, how many students have joined? I can see 23.
Yes, ma'am.
Yeah. So,
Good morning, ma'am. Good morning, sir.
good morning.
Good morning.
Okay. So, shall we start the seminar? Actually, it is already 11:03. So,
Okay, ma'am.
we should, yeah. So, Deepika ma'am, the coordinators are there, Ansar sir and Sumit sir, all, I think both are there, na? Sumit sir and Ansar
Ma'am,
sir.
yes,
Can
ma'am.
you hear me?
Yes, ma'am.
Yes, ma'am.
Good morning,
Yeah.
ma'am. Good morning, sir.
Good morning. Good morning. So please ask the class in charges to students join. Okay, please tell the class in charges so they can ask the students to join.
Okay, ma'am. Okay.
Okay. And while already sir is here, so without extracting much more time, we will start the seminar. So,
Okay.
students, can you hear me? Students, can you hear me?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay. Okay.
Yes.
Okay. Okay. So, good morning again to all of you. Today, we are celebrating the National Pharmacy Week, 62nd National Pharmacy Week. And on this, we have started this National Pharmacy Week from 17th and it will run till 21st of November. So in this Pharmacy Week here, it is our immense pleasure to have Mr. Shomo Dotto, GM, and as a cited of Glenmark Pharmaceutical Limited, Baddi branch. So let me introduce sir to you, Mr. Shomo Dotto. He is having 29 years of experience in the pharmaceutical industry, and he started his career from Relis India Limited, Chennai, as apprentice. Then working in different organizations in operations and in different areas like tablet, capsules, liquid, lotions, and injections. He worked with Albert David Ghaziabad also, Penasi Biotech, Baddi, Cipla in Sikkim, Thermo Fisher in Ahmedabad, and now he is working with Glenmark Pharmaceuticals in multiple locations in Baddi, and he also worked with Glenmark Pharmaceuticals in multiple locations like Nalagarh HP and Sikkim as a company of plant head and site head. So we can see that he is having huge experience. Some more feathers are there. in his crown. Like during this journey, this long journey, he faced different audits from different agencies like US FDA, EU, TGA, etc. And he is having a handful experience in greenfield and brownfield projects, and finally as plant head also. And he is taking care of finance, HR, PPIC, quality, EHS, WS, etc. And he is also in a role of leadership and got exposure to people's handling in different strategies to improve organizational health, productivity, improvement, self culture, external factors like legal compliance as well, industries laws, labor laws, environment, and Environment Protection Act also. So this is his brief introduction. I know that he is having more and more achievements other than that. So it is again it is our pleasure. It is our fortune to have Mr. Shomodatta with us. So without extracting much more time, I would like to hand over the session to Mr. Shomodatta, and he will enrich our students with his great and versatile knowledge. Over to you, sir.
Thank you. Thank you very much. You have given almost my whole biodata here.
Yes, sir.
So good morning, all of you, and thankful for this invitation to me. And if I start with the thankful to the whole faculty, all the students, I would like to greet Dr. Indrani Bhattacharya, Dr. Subra Bhattacharya, the seminar committee, the entire group of college. During this National Pharmacy Week, I like to interact and give you some insight what exactly the industrial culture and what is the expectations we have in our organizations or in the industry. It may give some enlightenment to the students where we really need to focus on. So with your permission, I should start on giving the brief on this. Thankful. Thank you very much. So shall I?
Yes, sir. Yes, sir. Please continue, sir.
So the topic which you have selected, the bridging academia and the industrial preparation for the students in the pharmaceutical workforce. Definitely, it is having a huge opportunity for us because this is the right age and time where the student should understand. Theoretical part is very, very, very important and critical, but at the same time, where we really stand ourselves to project us as the individual in the industry. So I was just coming up with some glimpse of the expectations, what industries are expecting. This presentation will explore the crucial bridge between the academia and the pharmaceutical industry. It will address the importance of the industry exposure, challenges faced by the students, and the strategies to developing the industrial relevant skills. So the major objective is to create awareness among the public, healthcare providers, and the authorities about the pharmacy profession and the role of the pharmacist. In India, we need to understand one thing. Because during the COVID, there was a huge learning for us. Everyone were under threat, and there the whole role was played by the pharmacist only. Because if without the medicine, without the new innovations, without the hesitating to help or running the plants and coming to the field, sending the medicines was a challenge. So here one of the important parameters where we really stand for the society. But it starts from the beginning, it starts from the college itself. So my opinion regarding this is not only the theoretical part, we need to really understand where we need to go and how to perform, where our identity, where our individuality can be projected, and where are the key things we need to learn before or during. Because pharmacy is a subject where we really need to learn each and every aspect, not only manufacturing of medicines. Here we need to learn machines. Here we need to learn equipments. Here we need to learn legal compliances. Here we need to learn audits. So, this presentation, I am just trying to brief some idea. What is the culture as of now and what is the expected for the industry? Like in pharmacy education industry and the product orientation in my introduction part, various educational institutes offering pharmacy degrees at various levels, like Doctor of Pharmacy program initiated in 2008, industry and academia. There are two sides of a coin. So we are very much dependent. Industry is very much dependent for these future pharmacists. At the same time, need to coexist with the mutual growth and development. And finally, the skill factor is very important for us. Current landscape, I will give us some brief idea about this. Like pharmaceutical education as on today is considering a lot of things, right? The primary focus on the providing strong foundation in the science, then in clinical knowledge and patient care. But we are often disconnected from the theoretical knowledge gained during the academia and the practical skill required in the industry. Here, I can give some insight. What happens, the theory is very important and critical, but often we found when coming in the industries, those theories are not in use. But it is not like that. Without knowing the theory, the practical knowledge is very tough for us. What is theory and what is practical? See, here in the industry, we are checking viscosities, we are checking pH, we are checking lot of other parameters like assay, which everything you have studied during your school or college life, right? But while coming to the industry, there you have used litmus paper. Here we are having the automatic pH tester. There you have a check viscosity with some formulas, but here we are having a ready-made instrument which decides what is the viscosity of the product. So without knowing what is viscosity, what is specific gravity, what is pH, what is DT, and using that instrument in the practical life will be tough. So knowing theory is very important. At the same time, using those equipment with the digitalization and the latest where the things and the results are coming automatically is tough. So here we need to really bridging or integrated the things, how it looks like. And this is just a small example from our end, because 100% things are changing while it is coming from college to industry. May result in the graduate who will well deserved in theory, but lack of hands-on experience need to excel in the industry role. So this is the part which I was just explaining. Now, what again the importance of the industry exposure, what we really expect and what the student will get help from us is the industry exposure provides students with the practical understanding of the pharmaceutical landscape, bridging the gaps between the theoretical knowledge and the real world applications. The networking opportunities the student gets which help, because pharmaceutical industry is a very small industry, right? Worldwide, if you see, we are having very limited access and approaches here. Here, knowing each other and supporting each other is very important. So student can gain this valuable networking opportunity when the industrial professionals expand their connections and the potential path towards the institutes or towards the colleges. Again, skill development is critical. Why I am telling the skill development? And the student acquire crucial skills like problem solving. Because when you are doing the same, studying the problem solving in the theory, and when it is happening actually in the plant, is having a different stories. Because theory says this, if you will do, you will get resolve the problem. But when it comes to the practically in the soft flow, all the theories is important. At the same time, your own knowledge and exposure towards that exact technical part is critical. Then other part like teamwork. The best part of the teamwork is we are so much dependent on our colleagues, on our bosses, on our juniors. So collaboration with them and technically understand their skills, and mutually we need to come up with the problems. Then communication, of course, communication is very important. Technical skill, as I discussed. Nowadays, there are a lot of automations are in the industry. Digitalization, artificial intelligence, everything has launched in industry. We are growing every day. India is very fast growing country, and these things are very common in any industry. Essentially for the success of our fast-paced industry. Now, in pharmaceutical industry, if you see, we are almost reducing the manpower and going for high accurate machines where the drug molecules, the assays, the machines are performing the accurate tablets or filled volume of the bottles or tube. We are having a lot of guidelines over it, so we cannot really come out from that. Here, again, I will bit explain regarding our challenges, what happens. That is technical skill upgradation. When I get the fresh person from the college in the industry, for 6 months, he doesn't understand where he was supposed to work upon and what is his passion. Now, every company is having their ready-made protocols for giving them trainings. Companies are giving training to use that student for company's purpose, right? Because till you are in college, and the shift from college to industry is having a very big change where you are getting salary or stipend from the industry. So industry is going to use you, your skills, your intelligence, your knowledge for industrial benefits. Industrial benefit is directly related to the profit and loss. So cannot compromise. Moreover, in industry, we are going to handle those important part where each and every patient is waiting when he will take the medicine and he will be cured. So overall, if you see, it is a very big impact when we are manufacturing medicine for a patient who is lying in the hospital and waiting for that medicine with the hope that he will be cured. So industry is always with their specific requirements of what the real person need to do, how the machine will perform, what will be the final output, and how the profit will go high. So for that, the mental setup of the students while coming from final year to industry, the change is giving them some cultural shock. कि अब कैसे होना है, how it is going to happen. But it is not tough. Year after year, month after month, once they are accustomed with the situation, when they learn the things, then they really grow up. And I also started when I was not knowing anything. We just gone through some books, I appeared for the paper, got some marks, and came out with the thought we are going to use these things. But when we came to the industry, we found the industry is far ahead in technology. Industry create pressure for profits. Industry cannot bear the losses. Industry cannot bear the mistakes. So how much we need to be get involved in our originality, in our experience, in our knowledge and dedication. This everything matters while you are in the industry. Because this transition from theoretical part to industry and putting yourself in the culture of industry where everybody is competing with each other for their own growth matters. So these are the some, it always comes in the normal theory also, student life is the best life, and that is true. Nobody can deny the fact student life is the best life. Even though you are in the industry in the first initial 3-4 years, that you can really enjoy. But after that, when responsibility increases, your thought process, your actions, your attitude changes. And that matters when you are coming from college to industry, right? We have some strategies which I feel like we can come up with that for developing the industry and the relevant skills. Even some colleges have started for giving them industrial exposures, bringing the students, but that is hardly for 15 days, 10 days. That may not be sufficient. Like industry specific courses. So we can build some courses in the same theoretical part where 3 months you have to spend in one department with some specific research work, or in specific department where you can really understand how the practical things is matching with the theory, because without knowing the theory you cannot do the practical. But integrating these two may help a student to understand where you can match up your thought, your theory with the practical things. Then obviously mentorship is there. Students with the industry mentors, like I got this opportunity to speak upon, I think my this discussion may help to understand. It will guide the students where we really need to focus upon. One thing I am keep on telling since from the beginning, without theory, practical cannot be known, right? Without Newton's, with the why the apple has fall down is perfectly okay. But without knowing the principle, you cannot work with the practical things. So integrating these things are very important. Then what are the projects we can take for the students? The case study. Even though it is an industrial case study and we give it to the students, how the industry is going to handle, that also can help a student to understand what is the practically happening. This is how what I was trying to say, that fostering collaborations between the universities and pharmaceutical companies. So suppose students are getting some research projects which they need to link with the companies, different factories. It may help to understand. Again, pharmacy course is having a wide range where they can work upon. But I am talking about the industrial part, right? See, if you want to go to R&D, then what are the studies, what are the courses you need, how you can develop? I think PhD is the minimum requirement. The MPharm may also not may help. But if you go into the marketing, then the complete strategy may change. If you go to the industry, your complete thought process will take some other part. Then if you go to the innovations, so those are also having separate lines. So B Farm itself is a very big base and having a lot of opportunity as of today in industry. So decision to be taken now, what line you are going to choose and how long you are going to take your life on that front. Definitely guest lectures are also there, which can help. And then finally, the industry advisory board. We can establish this industry advisory board to provide valuable insight and guidance on curriculum developments. What is there is there. What we need to add with that, like we have to further work for that. Then how we can prepare the students for the evolving pharmaceutical landscapes. Like what is the technologies as on today, emerging technologies as on today in the market that can also taken care during the theory part. Then personalized medicine, how the medicines are getting innovated or coming up in the markets with the research, that can also taken care. At least the basic part should come. Then we should really understand what is the global healthcare landscapes. Student will navigate the complexity of the global healthcare. See, again, any organizations is manufacturing more than 300, 400 type of medicines and SQs, which are going to be used at different fields, different diseases, different cures, and every part is having their own specialization. Just now, if I talk about some latest technologies which is in the market and all the industries are using, like smart level integrations. Not all the companies, but few companies has come up with that. Like integrate the digital smart ultra thin level, which provides the communication and alarm system in the integrated printing electronic circuit. QR codes enable packaging. In our medicines, we are producing giving QR codes. Simply, you can take a trial on your mobiles. You could check your QR code whether your medicine is authentic or not. Thermochronic links. We are detecting changes as per the environmental conditions. The condition changes, the environmental condition changes, the medicine changes its color, the packaging. So these are the new technologies. But the thing is how we are aware, or if we come in the industry, then we are learning these new things. We should focus on different aspects of GMPs. I think my slide is not moving. Ma'am, if you can help me to get the next slide.
Yeah, Deepika ma'am.
Sir, actually, I am requesting to you, please off the share of screen and
Sure,
then
sure.
again share this one and it will be continued.
Okay, okay. This is visible now?
Yes, sir, it
Yes,
is
sir.
visible.
Yes,
Yes,
sir.
sir, it is visible.
Okay, now, yeah, it's again moving. So now, in during our college life, we have read all the schedules like A, B, C, D. Now, Schedule M is very important and critical, and every pharma companies need to follow all the practices. And as on today, Indian Drug Authority and CDC are very strict on these guidelines, right? So we really need to understand what exactly in the guideline is. What is the parameter of the area? What is the conditions of the room? What are the machines? What will be the gap between the room? What will be the temperature monitoring? What are the particle size? These are very basic things which we need to learn. And you can see, while we talk about the GMP practices or we talk about the guidelines, these are the guidelines which is coming very strongly during the process. So knowledge of Schedule H, knowledge of Schedule G, knowledge of Schedule N, B, C, then of course Schedule M. These are the basic guidelines, and we are 100% following that. How it looks, how the things are implemented in the plant, executed, and what are the impacts if we don't do over the drug. That is the key aspect while coming in the industry. I talk about different legal things. While I am working in the industry, I found there are a lot of licenses you are need to take. Like putting an industry is not that easy. You need a lot of permissions, right? That is the industry of permission, manufacturing license, test license, price control, narcotic license, drug and magic remedies. Not only that, other than that, pollution department, labor department. So knowing this is very important while you are coming in the industry. May not be required at the first year, second year, in within a 5 years, but these are the important aspects because we cannot do everything as per the business. We have to follow all the government regulations. If I talk about the clean area classifications, now what are the things in the clean? How many types of filters are there? What is AHU? How AHU runs? What are the particle size? What is HEPA? How it is cleaning the filters? If you see those parts in theory, then only you will understand what is the airflow pattern. What is the pressure differential between two rooms? These are the things which really need to understand during a college and the industry, because the student come in the fresh and they don't understand whether how many times shall I open the door of the room so that the area should not be contaminated. This is also a part of the industry and our clean room areas. Then different machines. We read all the machines. We know the principle and theories, how it runs. But when you come in the industry, you may see the 10 other things. Like as on today, for blister machines, we have to put cameras so that broken tablets or any damaged tablet should not be get back. In our machines, there is a temperature control. It should not exceed the temperature so that the product loses its integrity or its color or its assay should not be less reduced. So machines are that much high profile or automated as on today. We need to control all critical parameters while the product is getting packed, or while the products are getting manufactured during the granulation or in compression or in liquid manufacturing or in filling. So every aspect need to be verified while studying in the theory and correlate the theoretical part with the practical part. Because knowing theory is very important. Then only practically you will understand the basic concept, how the things are related with each other. But the automation part, the AI part, the learning part, the machines controls part is again very critical. As I was talking about air handling units, I was talking about here if you go to the QC, you can see HPLC. You might have read the chromatography, different types of chromatography, how the adsorption takes place, what are the injections, what is the run time, what are the solvent we are using. Now, you have studied, but while you are seeing physically and practically in front of you, you can see this everything, how critical. Even for our balances, we are using 0.004 times 0 after decimal 0.4. That is the accuracy level we maintain while using or weighing our tablets. So you can understand the imbalance. What are the calibrations? You might have read calibration. What is the other parameters, linearity of the balance? How the balance need to placed at the soft flow is having a practical as well as theoretical things. What is the load cell which is used in the balance? What is the standard of the load cells? These things comes when you are come in the practically in the industry. Anyway, then again further batch records. You know, as on today, data integrity is very critical in the industry. At any point of time, you have to record each and everything which you are doing or process is happening. You have to record everything. Initially, it was manually. Initially, we had some additional booklets we can use, but nowadays it is completely SAP or automated. Now there is the electronic BMRs. If you entered the reading once, you cannot manipulate it. So the accuracy level or the data controls are also very important in as on today, because nowadays suppose your temperature is 80 degree in the FBP and you have set 78 to 82 with the range and it goes 83, machine will stop automatically and this record it come in the record directly in the your VMR or BPR that your product has having some 1 degree temperature change. That is also get recorded and we have to justify it why this out of specification or this challenge has come. So this is the how the accuracy level we are maintaining, the documentation part we are controlling in the industry. You are writing exams. In exams, you are writing whatever the question has come. Have you ever thought to give all those details relevant to the questions are 100% accurate? That is the part, the difference from that your theoretical exams and here in the manufacturing process BMR. Because 1 degree need you to put justification why the 1 degree has fluctuated. So that is the key aspect. That is nowadays very critical as a data integrity. You really cannot manipulate a single parameter in the industry. Now, this is my last, the bridging the gap between the pharmaceutical education and the pharmaceutical industry is essential for fostering innovations, improving education, and enhancing patient care. By working together with academia and industry can create symbiotic relationships that benefits both sector and prepare student for a successful career in the pharmaceutical field. This is the base where we are standing as on today. And now we are expecting that students should come in the industry with the pre-planned mind setup so that we can give them training. Yes, trainings are always there because situation changes. But if theoretical knowledge is very strong, he can capture in a week or in a month. Or if theoretically is weaker, then it is tough to capture all those changes which I am talking about in the industry. And he started struggling over it. From my side, thank you very much. This much. If you had any question, you can definitely ask.
Thank you, sir. Thank you
you.
very much for the informative session. I hope the students who have joined over here, they have gathered a huge knowledge from this webinar. Apart from the students joining over here, we are streaming this session in a YouTube. So I hope many students who have not yet joined, but they are in some other colleges, they can have this seminar. They can see the seminar in the YouTube live streaming. So this seminar, I hope everyone found this is very informative. Sir, I am having some basic questions on the behalf of the students. I would like to ask some basic questions on behalf of the students. So may I, sir? May I ask some questions?
Sure, ma'am.
Okay. Okay. So, sir, being a person from pharma analysis, my specialization is pharma analysis and quality assurance. So, being pharma analytical students, and now I am in this field, in a professional field. So, on the behalf of student, I would like to ask you that what are the basic instruments a student must know, a beginner who are aspiring to join in the pharma industry? So they must know which instruments basically in the entering point when they are starting there, when they will start their career, as we are having 7 semester students with us, so they are aspiring to join the industries. So what are the basic instruments they must know, sir?
The question is very interesting. Actually, again, let me start with some basic. If you ask me instrument, so I have to ask which department they are interested upon. Whether they are interested in tablet, then everything will change. Whether they are interested in liquid, everything will change. So it starts from where they want, which department. That also, at this age, they cannot decide which department they are going to join, because the industry will give opportunity where they need a vacancy. So pre-decision of that which instrument or equipment they want to learn and join is tough. But knowing the principle behind all the equipment and instrument is important. Suppose anybody is willing to join QC only. In that case, he knows the Carl Fisher, he has to understand, the HPLC he has to understand, photometric, he has to understand assays, testings, chemicals, this, okay. But if you come to the production operation side, then company decides what if he goes to the injection. As on today, this injection is a very vast in India, like autoclave. Yes, definitely it's critical. But learning autoclave is important, but it may not help if he joins in tablet or in liquid or in other areas. So theoretically, they must know all the equipments, at least basic. That can be done 1 month or 2 month training during the theoretical courses in any, along with any industry. If they go in the industry 1 month or 2 months, he may understand which compression machine used for, what are the toolings, how the tablets is getting metal detectors there, check wells are there, DT apparatus are there, granulation, how it is happening. But individually going in depth for individual machines, it can happen only after joining the industry. So knowing instrument, definitely it's required. But knowing GMP is important than the equipments. I hope okay.
Okay, thank you, sir. So some of our students are here. If anyone have any question, you can please unmute yourself and ask the question. I would ask the faculties also, if you are having any question on behalf of the students, you can ask.
Good morning, sir.
Good morning.
Actually, I'm the Ansar Laskor. I'm the assistant professor of the Pandavesha School of Pharmacy.
Good morning.
So, actually, sir, thank you so much, sir, for your wonderful presentations. We really appreciated your valuable insights on bridging academic and industry in pharmaceutical educations. Your talk was informative, engaging, and inspiring. We gained a lot of knowledge and grateful for your time and experience. And thank you so much, sir.
Thank you. Thank you very much.
So,
You're supposed to ask question.
actually, thank you, sir. So I have one question regarding this on the behalf of the students.
Sure.
So, sir, my question is that, so what is the current trend and challenges in the pharmaceutical industry, and how we can teach the students to prepare for those challenges?
See, let me tell you a few other points to bring back to your question. Your question is very valid. First of all, the most dynamic industry is the pharma industry. If you prepare one medicine, you may not be very sure whether it is going to last how long for the patient. We are giving only 2 years, 3 years of expiry. Right. Now, getting APIs, where the medicine gets start manufacturing till FG and going to the patient or to the customer, there is a lot of dynamic changes happens during this journey. So the challenge you are asking as on today is not how the things are. The challenge, major challenge which we are facing is the regulatory audits and the expectations of the customers from the medicinal industries, right? If you see the which medicine will work on patient and from where it starts, what is the location, what is the stability data speaks. So this everything comes under this consideration. So for us, GMP is not good manufacturing practices. We put a small c in front of G, current good manufacturing practices, because every time the situation changes for us and we have to comply with that. Every moment there is a lot of innovations, lot of challenges comes, so accordingly we need to change. So we are not very much focused on what challenge comes. We are more focused on how stable we are with the existing practices, how we can give them the real world exposure so that the student can match with that. So you cannot really focus on what are the challenges you need to understand. You have to give what are the basic things required to come for the industry, because the situation changing. So you cannot fix that parameter. I think you are a bit clear about my answer.
Yes, sir. Absolutely, sir. Thank you so
Because
much,
you
sir.
really cannot fix the challenge, right? So
Yes, sir.
you should have to make your theoretical part and your thought process should be clear. If I have to move in that way, if any challenge comes, I will handle it. Something like that.
Absolutely, sir. Thank you. Thank you so much, sir.
Most welcome.
So now I am requesting to the students, if anybody have any questions regarding these topics or
Good morning, sir.
anything.
Good morning,
Yes,
sir. Myself, Deepika Rani Sahu. Here, one student is asking the question. Vaidyanath Datta Vaidya. He is asking, sir, can we join industrial training during college days?
Yes, you must. And if you get this opportunity, definitely go there, stay, and see the culture inside. See the machines, learn the processes, learn the testing part, see practically. Actually, in pharma industry, until unless you get a proper training, they may not allow you to do the job, but they will allow you to stand and observe what they are doing. That will also help, because that any organizations will give you proper GMP practices, will proper testing parameters, proper machineries. Otherwise, they cannot run. So it will definitely help you if you join. And I think it should happen since second year itself, second year, third year, fourth year. And if every year you can join for 3 months, so total 9 months you can cover during the your study period. And after that, obviously 1 year or 6 month industrial training up there. After that, any industry you will go, they will take you in as an apprentice. Then only you can come to the actual job role. It is in the industry practices, but if you change the line, like if you go to the marketing or R&D, they have some other parameters. But you should join.
Thank you, sir.
Even as our organization, we are giving this opportunity to give them handful training to all the newcomers as the apprentice or as the industrial training.
Definitely, sir. Sir, another question. What is more important between theory and practicality for industrial pharmacists?
More important means, see, without knowing theory, practical, you cannot really accept, because practically things may change, but basic theories remain same, right? So if you know what is viscosity, so tomorrow, when you are doing viscosity, you may not have to learn what is viscosity. But if you don't know what is viscosity, and today somebody is asking, please test the viscosity and what is the background, why this viscosity is. Or if you're testing pH, you know the term pH, right? Now, if you don't know the theory and today you are testing it and somebody is asking you what will happen if it goes high or if it goes down, low, you may not have the answer for that. That's why theory is important while do the practical. So everything knowing in theory and applying in the practical way, because we are not doing anything non-practical, non-theoretical things, right? We are very much scientifically clear. So science comes from the theory itself, right?
Yes,
So
sir.
whether it's R&D, whether it's our production or its operation or in QC, chemicals having their own parameters, own limits. But without knowing that, if we add both the chemicals in one, suppose I ask you in practical training, you might have do some challenging work like putting acid in water, and sometimes it gives a huge sound and blast. Have you done that? Or if I ask you, have you seen acetic acid? Have you seen citric acid? Now, putting those chemical in jar, how you are handling it is very critical for us, because these acids will give a burn to your body. How will you know until unless you read the parameters or the characteristics of those acids during the theory? So that is the part where we need to understand that without theory you cannot do the practical. So while you are doing the practical, you should know what is the backup of it.
Okay, sir.
Anything else, ma'am?
So next question is why the salary of industrial people are so low in India?
Very nice question. It is depends on the person, ma'am. Salary is not low. If you are a great person, you will get the best salary. Because as on today, if you see the market survey, after IT, pharmacy is the best payer in the industry. And some companies which are really great and they are paying a huge. But if I say my college life and this time the new generation college life is a bit different. I was aware that after passing out a technical course, I will become a something. But now the student have that expectations that after passing out, I will get some good job. So I was not aware which job I am going to do. But today students are very clear about I have to join in this industry and I will get that salary. So the expectations is problem. But if you are in the industry for a long time, say 5 years, 6 years, and you are very good in your knowledge and the attitude wise, you will get handsome salary. And definitely after coming these two sectors, one is in ACZ. All over India, pharma is coming up like anything. ACZs are there in Indore and Ahmedabad. Then industry in Baddi and Sikkim. We are running behind with the pharma professions, peoples, students. So you're paying high to get them. So it is not low. Yes, certain people will keep on going, because if you keep on increasing your expectations, then salary is low. But it otherwise low.
Initially, it might be struggle for everyone.
See, initially we are paying around, it is not only we, it is in the industry, it is standard around B firms starting with the 12,000 rupees per month as a apprentice, and M firms are with the 15,000 rupees. But after that it increases accordingly. But it is 100%, it is 100% performance based. So you cannot change that in the industry.
Sir, another question. Sir, what kind of skills we should need to develop as a fresher to join pharmaceutical industries?
I am not talking about the skills because industry will give his own skills, but definitely 2 things, 3 things we need in the industry. First, what is the attitude part? How you are adapting or learning the things, how fast. Anything which is given to you cannot say मुझे नहीं आता है and I don't know. Immediately you should say yes, let me try and let's see whether I can success or not. So that is not skill, that is a simple attitude and mental setup. Definitely you should able to speak out and give your actual requirement to the industry. I am like that, I can do this. Lot of time what happens, students come with the cultural shock, as I was written. I don't know what will happen. And they get a setback over it. And they cannot put themselves very clear and open in front of the management. And that is the setback. And there they get lacking and not getting the proper knowledge of it. Otherwise, if you ask me particular technical skills, then I will definitely say which are theoretically like all the schedules, like schedule M. We have to follow at any point of time. So you have to know what is that. It is not skill, but you should know what will be the size of the cubicles, which air, what particulate air we required, how much air change is required in the room, what is pressure differential, what is the boiler, it is not there, but what is the steam requirement in the industry. These things, if you learn, and when you see and track it with our practical uses, then it will helpful.
Okay, thank you, sir. Next question. Sir, what should student do to improve their chances of getting hired in the pharmaceutical industry?
Knowledge. Knowledge and knowledge. That is the only key to survive, because I don't see any other options to go higher. If you have a good qualification, if you have a good knowledge, definitely you will grow. But how fast you want to grow, that matters. Because if you want, today I have joined and after 6 months I will get a promotion and after 6 months I will become a vice president, it may not possible. But knowledge and qualification is only criteria to help him to grow.
Definitely, sir. Okay, sir. Thank you. Next question, sir. What are the basic skills a student should learn in the college to be able to ready to join an industry?
I think industrial training will help, ma'am. Individually, any skill may not help because you don't know which industry you are going to join. In that case, the person should know what is the theoretical part, and after joining in the industry, he should specify his interest and go there. Like
Particularly in college, during college days, how the student get themselves prepared to go into the industry means during college days.
during college, 6 months or 1 month industrial training will help, ma'am. Otherwise, in the college, what are the theoretical part you are studying is more important, because in that level, you don't know what will be your future, where you are joining. Are you sure you are joining in the injection plant? Then only you can learn, your skill improve. But after passing out the college only, you can decide your life, right? So before that, it is very tough to decide that which skill I should develop. Because industry is versatile, injection is entirely different story. Tablet is entirely different story. So specific skill is tough during the college. But taking knowledge is very important during the college. Like if I talk about the B.Pharm student, if he can go to the API plants, or if they go to the formulation plants, both are an entirely different story. So getting skill during the college period will help only the industrial training. As much as time you spend with the industry will help. Because like me, I can give you some ideas what happening in tablets. What are the equipments we are using in liquid oral, or what are the equipments we use in the ointment. or injection. But after passing, which industry is going to join matters. So skill means again GMP.
Okay, Deepika madam, this is Niladri Ghosal this side. So I want to do a question to sir.
Please.
Can I please do this?
Excuse me, let me just tell you that sir might have some other important schedules. So let it be the last question of the session. But 1 hour is already completed. So let it be the last question of the session.
Ma'am, one more question is the last question, the chat box. So after his question, one more question. Then we will
Let
end up
it
the
be,
session.
let it be. So I think sir is having some other schedules, also important schedules.
Yes,
Okay,
yes, sir.
so
Of course,
yeah,
ma'am.
so let it
Okay,
be the
sir.
last question.
Sir, good morning. Good afternoon, sir.
Good
It was a very
afternoon.
interesting session, and I'd like to very thankful for your knowledge and sharing your experience. Sir, I want to know behalf of our students that what about the EHS and how they will do the needful. Actually, the five indriyas will be working to do enter after entering to the industry, each and every person. So it is very much needful to each and every students also to what to do after entering to the industry, and at the mean of last session means what the pain they actually need, and what the aprons, what the housekeeping, as well as how they are chemical they are using, and the narcotic sections. Okay, this will also a very practiceful job for each and every pharma industry to grow up themselves, as well as to stay on the job respectively. So, sir, this is my question from.
You are talking about EHS, you are talking about housekeeping, you are talking about.
Yes, sir, all the necessary things actually.
Right. Again, this is the part and parcel of our industry, right? Because if I talk one after one, if I talk about EHS, see, we are using chemicals, right? Now, does this chemical is having an impact in the environment? If yes, then how much? We are withdrawing water from the through the bore well for our manufacturing of the tablet, liquid oral ointments, right? So how much water we are going to withdraw, how much water we are sending for treatment, how much we are using is very important. And nowadays, governments are very much having guidelines, how much you can do, what is the permissions. Now, what are the hazardous waste is coming out after this production? Say we have taken 100 kg of API and manufactured the batch of 1000 kg. Are you sure that 1000 kg completely you are converting into tablets? No. Possible it is 980 kg. Then where the 20 kg has gone? So that 20 kg need to be accountable where it is. And that's why this every parameters need to be finding out. What are the housekeeping doing? See, as on today, suppose you are taking diabetic medicines and some BP medicines are getting cross-contaminated with that. The patient will die, right? His BP will go down. So this is the matter of cross-contamination. So housekeeping is also very important and critical while doing. Even our housekeepings are qualified and we give them how much quantity of disinfectant you are going to add and how many times and what is the frequency you have to clean the area. If anybody is wearing footwears, what is the microbial contamination is there in the footwear and his dress need to be evaluated. So if you talk about the criticality, it is definitely this everything is relevant and required with that. Just can you repeat your question if you are not satisfied?
No, sir, I'm satisfied, sir. Okay, sir. Thank you.
Okay.
Sir, one last question, sir, in the chat box, and it is so much interesting. Why pharma industry do agreement with the freshers for 3 years or 5 years?
Very interesting. And you are asking why all companies confidentiality. We are very scared of after giving the training, they leave and join other company for better salary.
Yes, sir, definitely.
So we need some guarantee. If we train them, at least they should stay with us. Actually, what happens? No, this again, you people are very young to me, but I should not speak. This generation really wanted to grow very fast, right? So once they joined in one company, they learned something, they will go in other industry, they will give the interview, they may get a hike of lakh, 2 lakh, 3 lakh, whatever, and that industry will take him, and I have to start from the beginning and go again and search a candidate, bring them and teach them and train them, and then he's in use again, he will search a job. That's why industry is expecting at least stay for 3 to 5 years with us.
Sir, definitely, sir. Thank you, sir. Now I'm requesting you to please stop the screen sharing of yours, sir.
Yes, yes.
We would like to present the e-certificates. Okay, sir. Thank you, sir.
Thank you, sir. So, similarly, the last question was very important. So, sir, it is, I would like to tell you that it is not the case of only industry. In our institution, in different institutions even, so all are facing same problem that freshers are joining and they are having some training in the institute initial time, and after that, after gathering the training or the skills, they are joining in with higher salary some other institutes. This is going
Right.
on, I think, in every sector. In every sector,
Exactly. Exactly.
yeah.
Yeah,
So
in my opinion, we don't need to hold them back because after some time, see, we have to teach them. Suppose at the young age, you are changing industry every year, but after 10 years, your resume will say you have changed 10 times, so you are not a stable person, and he will get rejected after that.
yeah, yeah,
Your resume will not get approved by the HR or the concerned peoples. So
yeah,
that need to understand. But if you stay for 3 to 5 years in one place, at least they can justify, see, I have worked there, I have learned, and I have given them back. And
yeah,
then if changes, it will help.
yeah, definitely. Okay, so I hope students gather so many many informations from this session, beautiful session, and I would like to tell everyone that sir is already associated with us. Sir is a member, important member of our Industry Institute Collaboration Cell, and in many ways sir is also helping us for different in different aspects, and in future also we are wishing that sir will be with us to enrich our students time to time, to help our students uh, in different ways. So thank you, sir. Thank you very much.
Thank you.
So I think it is
Bye-bye.
already late. Thanks for the informative session. We will not extract your valuable time more. So in future, we will again connect to you, sir, and I hope you will be with us. Thank you, sir.
Thank you. It was a great day for me. Lot of thanks for this opportunity.
I would like to thanks our coordinators also for successfully conducting the session, and the students from our college, from other colleges, to patiently be in the session, and future in future we will try to again connect with some other personalities from some other industries and sir as well, so that there will be a strong collaboration or strong academic industry relation should develop. So thank you,
Thank
sir.
you.
Thank you once again.
Thank you.
Thank you, Deepika ma'am. Thank you, Ansar sir. Thank you,
Thank you
Sumit
so much,
sir.
sir.
And thanks to all students, our director sir, and the management as well. Thanks to all.
Thank you.
Thank you,
Thank
ma'am.
you very
Thank you so
much.
much, sir.
Thank you. Now we can end the session.
And madam,
yeah,
this is
हाँ,
the certificate of SARS for appreciations with us,
okay.
and we share this
So,
one.
yeah, we will send the certificate and some other gifts to sir by post also. And second thing is, have you clicked the screenshot?
Yes, ma'am.
Okay, then please share it with us. Okay,
Yes,
in
ma'am.
different groups. Okay.
So I am requesting all the participants to on your video to take
Hmm.
its screenshots. Please.
Sir has left, I think.
Sir
I'm
has left.
requesting. Okay.
Sir has left. Sir has left. Let it be. If you took the screenshot, then it's okay. We can share the screenshots. Okay. Thank you.
Okay.
Thank you.
Thank you. You can leave.